And that was a report on liposuction, and it's the introduction to our first topic, which is about liposuction and its new techniques. With us in the studio is Dr. Nedhal, Ayyub, a cosmetic and surgical dermatologist. Dr. Nedhal, welcome to the program.
Well, thank you for having me here.
It's our pleasure. Now, let's jump straight away with the definition of liposuction. What is it?
Liposuction is a surgical way to remove excess fat from certain areas in the body. And it has been improved since years, especially in this century. It has been a painful procedure with less...
It used to be painful?
It was more painful because the patient had more downtime after the surgery, and they used to use bigger probes, and the patient used to be under the surgery for a longer time. But now with sedation, under sedation, of course. But now with the new technology and a new progress that we have dramatic improvement in the process of liposuction and the patient downtime and recovery time after the surgery. So it's becoming more easier and becoming more impressive procedure than before.
That's wonderful.
Yeah.
So, Dr. Ayyub, so if you could tell us a bit about what are the new procedures, the new techniques that are being used.
Yeah. I want to inform our viewers about different varieties of liposuction. There's traditional liposuction, and there's another liposuction which is a laser liposuction that we go ahead and under sedation and with the use of tumescent anesthesia. It's a kind of fluid that we inject inside the fat tissue to make it less, to make it actually extend, and it gives the numbness that we need actually for the surgery and to relieve also some pain afterwards. And then we go ahead and destroy those fat cells with the laser, and it becomes like emulsive or like a fluid, the fat, and then we can suck everything out with less trauma to the patient. Less trauma to the patient and better outcome and more fat release from the patient.
And a lot less pain.
And of course less pain afterwards, because less trauma means less pain after the surgery. And there's another one, which is an ultrasound assisted liposuction. We use the technology of the ultrasound. It's very accustomed to liposuction, and it helps to destroy the fats in a nice way and also tightening the skin, because it's not only that you want to take the fat out, you want also to tighten the skin down and to give the sculpturing and the shape of the body. It's not just an area that you want to flatten. Every surgeon can do that. The idea is to sculpture the body and give it the shape and the shadows that you want to see in a healthy, athletic. So it has been improved since we know it, since we know the traditional type of liposuction.
So how new is this technology? Is it
actually
5 years, 10 years?
It's about 10 years. The last one, which is an ultrasound system, is about 10 years, but it has been now in the clinical practice here in Saudi Arabia only just a few years ago.
Yeah. And when you were describing it, you said it's the process of removing excess fat.
Yes.
So
it's not if you want to ask, it's not a procedure to make people slimmer.
Okay.
To lose weight. It's not an ideal procedure.
So how do you differentiate between suitable candidates and unsuitable candidates?
A suitable candidate is a candidate for surgery those who has a little bit overweight, not means overweight, I means over the normal weight for their height.
So by body mass index?
Body mass, we go by body mass index, and if there's a slight, like few kgs above their weight, we go ahead and do those. So those are the people who are candidates, and they have an idea, they have an area which really bother them, and they want to get rid of the fat over there, like the hip area in the females, or the tummy in the males or females, the arms, the chin. That's where you go ahead and do the liposuction for them. Whatever they do, whatever they work out, no matter for how long, they still have those areas annoying them.
Yeah.
So I think liposuction will save this hassle for them. I mean.
And when you remove the fat, does it come back?
When you remove the fat doesn't come back. The same cells that you remove does not come back. The fat cells. The fat cells are new. No, the fat cells that has been left behind, they become bigger and bigger if the patient keeps on eating and gaining weight. Become bigger and bigger. And the patient, of course, will gain fat or accumulate fat and store fat in different areas. Other areas that you haven't done liposuction on.
So when you do liposuction,
Yeah.
when you remove the
Yeah.
fat, you suck
Yes.
out the fat. You're sucking out fat cells.
Fat cells.
So that means
Yeah.
if I were to undergo liposuction to remove, let's say, the waist area,
Yeah.
this means that my body cannot store fat in that area. You've removed
Your fat cell, you can still store some fat over there,
Yeah.
but definitely if you gain extra weight
It will not be
after the
stored there.
surgery, you will gain weight all over the body, but that area will be less than the other. Will stay less than the others.
Wow.
Yes,
Okay.
because if the fat cells that you left, because you don't suck everything, we leave something to keep the tone of the skin.
Yeah, of
so
course.
those cells will inflate and expand and show as if the patient has stored some fat over there. So it's always, after the surgery, we always ask the patient to adjust their lifestyle, exercise and diet.
And what kind of trauma does a patient go through during the surgery and after? So what's the cause of the trauma? I mean,
Yeah, the trauma is when you go ahead and do liposuction, we actually use probes, okay, and cannulas. The probe that to produce the energy that we need, the ultrasound or the laser, and the cannulas to suck out the fat. So it's strokes that we do back and forth, and those strokes can cause some trauma to the subcutaneous fat. So you need to be familiar with the anatomy, and to know where you're going at, and you do it safely. We know those procedures has to be less than 1% complications, because those are elective procedures. Elective, if the patient comes, walk into your clinic, wants to have this done to him, he's healthy, he's fine, he's bothered with this area, you want to give him a good medical service without jeopardizing his health.
Exactly.
Right?
Exactly. Yeah.
So it usually carries less than 1% complications.
Well, that's good.
Yeah.
But Dr. Nedhal, talking about sculpting the body and
Yeah.
someone being a good candidate if they're not overweight or obese, shall we say,
Yeah.
just having a little bit of excess fat to
Right.
lose in whichever the problem area is. But so, Dr. Nedhal, what potentially could happen? Is a possibility of scarring when you do liposuction?
Yeah.
Or does it leave indentations in the
Yes.
skin or dimpling or
Yes, that's a good
on
question.
that area?
Actually, if it's done superficially, or if you overdo it, yes, you can have some indentations or depression into the skin. So you have to be also aware of the right techniques of doing it, and not to take too much fat. Too much is bad also. So you just take enough amount, and this by experience, you know when to stop taking the fat, and you go with the right level. Not to go very superficial, not to go so deep. It depends on the area. It depends also on the fat distribution, because there's some fat which stays deep lay down into the body, and there's some areas the fat are really superficial.
But Dr. Nedhal, talking about that, what are the percentage or the rates of sort of bad liposuction being done to patients? Is it mostly successful? Or
Actually, this is a very also good question, because we see this every day. There are some people who are not specialized in this, and we're seeing some patients with complications, and we're seeing some bad results. Complications happens to anyone, to everybody. But the issue is you want to minimize this by doing that mostly in the right way. And the patient, as I said again, it's a cosmetic procedure. The patient comes with his will to do that. So you want to give him the service that he wants. So we see this every day, and it's still happening, and there are some patients who are not satisfied with this. But we have to go back to the patient and doctor relationship. They have to have almost equal expectation. All right? You want to minimize the difference between you and him in the expectation. Like, you won't be a different person. You're not the same person, but you'll get rid of this. But some people, they have really fantasized about results that cannot be achieved.
Like a magazine look.
Like a magazine
You
look.
know, like in one of the pictures that we saw in the report, there was a man's torso, and it was really perfectly defined.
Yeah.
But, you know, can you actually receive those kind of results?
Yes.
Can you produce that?
Yes, we can do that.
And similarly for a female or
Yes, absolutely,
whomever,
but
a
not
flat
but
stomach.
in the right candidate, Like I can't get an obese guy or obese female and get her that body that she saw yesterday in the magazine. No, of course not. But she has to have at least some sort of fitness, all right, and shape of the body, and a little excess of weight that I can handle. If she's overweight or obese, it's really hard to do that. We go ahead and do liposuction first, a regular liposuction, just to make the fat less, and then in a second session or a different time, we can do that definition you're talking about.